coordinator for Raising Women's Voices, which is a national initiative dedicated to making sure that the concerns of women are heard as we enact the Affordable Care Act.
Yeah.
Good morning. Raising Women's Voices and I are grateful that President Obama has reaffirmed his commitment to women's health by making sure the key preventive services we need will be covered by our insurance companies with no additional costs like copays. These preventive services do include contraception and also several other things that aren't getting as much attention. For example, there now will be insurance coverage for screening of pregnant women for gestational diabetes, support for women who are breastfeeding, and screening of women for domestic violence. The administration's decision to include contraception in this package of women's preventive services was made on the recommendation of a panel of independent medical experts at the Institute of Medicine. The experts noted in particular that contraception helps women plan and space pregnancies, thereby producing healthier women and healthier babies. That is certainly a health outcome that we can all support, and recent public opinion polls show that a majority of Americans agree. Unfortunately, some politicians are trying to derail this important advance for women's health by insisting that employers who object to contraception on religious grounds shouldn't have to provide it for their employees. That was surprising, since President Obama had already taken steps to exclude churches and other houses of worship from having to cover contraception for their employees if their faith doesn't allow it. The president went even further last week to address the concerns of some religious leaders by announcing that religiously affiliated employers like Catholic hospitals, which didn't qualify for the church exemption, still would not have to pay for contraceptive coverage. Instead, the president announced that these employers' insurance companies would be required to pay for the coverage, which they want to do because it saves money. Every dollar spent on contraception saves about $4 in costs for more expensive pregnancy care. Under this sensible accommodation, women will get the preventive health care we need, while religiously affiliated employers who object to contraception are protected from paying for it. We applaud the White House for working hard to keep its promise to millions of American women that we would have affordable coverage for preventive services regardless of where we work or what our employers believe. Contraceptive coverage is only the latest benefit that women and our families in Ohio and around the country are getting from the Affordable Care Act health reform law. Already, 2.5 million more young adults have health coverage because they can stay on their family policies until age 26. And in 2014, women will get an important benefit against gender rating of health insurance policies, which means that insurance companies will no longer be able to charge women more than men for the exact same policy. Next month, Raising Women's Voices will be launching a Countdown to Coverage campaign, educating women about what we and our families are getting from healthcare reform, starting with contraceptive coverage this August and moving into 2014 and beyond. The women here today, and the women and men across Ohio, are tired of politicians who try to score political points with women's health. Women's health is not a political game to be won or lost. Providing comprehensive coverage for women is the right thing to do, and covering contraception without copays will have a tremendous impact on women's lives and help our families be stronger and our lives be better. Thank you.
Join us today. Before we close, I wanted to add that the American people are on our side on this issue. 98% of Catholic women, myself included, have used birth control at some point in their lives. 61% of Americans and 61% of Catholics agree with the president's decision on this issue. The American people are on our side. Again, thank you so much to everyone who joined us. A special thanks to our speakers, and now I'd like to open it up for any questions there may be.
Do you feel like you're going back in time to a point where women's rights were not acknowledged? Is this a women's rights issue, or is this a purely contraceptive issue?
Women's rights. I would say it's all the people's rights, because it has to do with all our families.
Right, but I think
men's rights too. Yes, I would agree with what she's saying, but it is definitely a women's rights issue because, again, we are just issues that have been settled a long time ago. We're in 2012. Give me a break. I mean, really, this is about, women's rights, and they are slowly being eroded again.
Do you think young women appreciate that?
No.
I'll tell you a story. Working with staff this week on the amendment in regard to IUDs, and I have a daughter who's 37 years old, and I worked for a government agency when I was pregnant with her, and at the point of being 6 months pregnant, I was going to have to stop working. That was 37 years ago. That's not that long ago. Thank goodness they changed the rule like 2 weeks before I was going to have to quit. It used to be that teachers would have to stop working once that they looked like they were pregnant. And that's a shorter time ago. So I don't think, I look again at young people in the room, our daughters and everything, they really don't know what it was like in terms of, how far we've come. And so, yeah, I do think, but it's like, it's one of those things you just think it's always been that way since you've, been eligible for those things, or you were at the age that you needed contraception. So again, I do think that this is the way it should be, and the fact that we're going backwards, I think, is a shock to young women.
If I can dovetail on
Yes.
that, I'm 27 years old, and thank you. She could be my house. I call women around my age the post-Roe generation. We have never had to fight those fights, and because of that, we don't appreciate, I believe, what we have there. You see what young women here on stage and young women in the back of the room who do know what's at stake. But a lot of women have just never had to deal with a world in which these things were not an option.
Thank you.
In which there might be a personhood amendment passing saying that women can no longer have birth control pills or any sort of hormonal contraception, in which IVF isn't an option, in which life begins as soon as there's a fertilized egg. We've never had to deal with this. And so that is why I'm so passionate about our work here at the Ohio Democratic Party and with the Women's Caucus to reach out to young women, let them know what's at stake. Let them know that even though you might think it's so far from reality that these things could ever be taken from us, it's not. Virginia passed the Personhood Amendment through the House just a couple of days ago. Mississippi, we saw it defeated there, but we can't take it for granted. So we are going to be working day in, day out, tirelessly to make sure that young women and all women in Ohio know what's happening, what the facts are, and how they can change the face of power in this state and nationally.
To know our history. I mean, it has been shared over and over. Those who don't know their history are doomed to repeat it.
Right.
That's why we have the Center for Women's Policy Studies, which brought 18 legislators from throughout the United States together to do a simultaneous introduction of the women's reproductive rights and justice. It's about rights and justice. It's about what's just and what's right. Together so that we could focus attention on what's going on in America and why we are going backwards. Education is important, history is important, and if we do not continue to educate young women and young men where we've been, we are doomed to go backwards.
Right.
Right?
Anyone else?
Do you have anybody?